We can hear your frustration at the lack of accountability for what's happened. I just want to know, how much of the blame do you think lies with individuals, and how much of the blame do you think is more organisational, or perhaps even with services nationally?
I'm going to address that. I'm going to address it as a consultant working in the NHS. I'm going to address that as a doctor from a medical family. And what I want people to understand is that when you go to work, when you get your paycheck, you do it with responsibility to do the best for your patients. Now, psychiatry is one branch of medicine where treatment of a patient does not just impact the patient and their well-being, it can impact the people around them. It is the only branch of medicine where a third party can be hurt, where a member of family can be killed, where a patient can take their own lives, where a patient can take the life of a complete stranger, where the patient can take the life of a child, where a complete stranger can take the life of my child because of their choice on treatment. Now, if you have cancer and you decide my disease is not curable, I choose not to have my treatment, that is your individual choice. But within the psychiatric speciality, it has to be remembered, it is not just the patient's health that is affected, it is public safety that's at risk. And I think for that reason, accountability is incredibly important. If any of those individuals thought that Valdo Calocane was going to go out and share student accommodation with their child, I suspect their choices may have been changed. If any of the healthcare workers thought that Valdo Calocane was the next door neighbour of their parent, I think their choices may have been slightly different informed. I'm concerned about the empathy, I'm concerned about the 3D thinking, and of course risk assessments and retrospection. I think there was laziness, I think there was, and I think all of this contributes to the fact that accountability on an individual level is essential.
But at the end of the day, it is individuals who make up a system. So if you don't hold individuals responsible, the system will never change. And to your question about changing systems, I believe the only way of doing that is by holding individuals accountable.
Now, the families spoke about hundreds of reports that have previously done about failures of mental health services in England, and they have said they want this now to be a watershed moment. There has been a promise of a judge-led inquiry into the attack in Nottingham, but the families say that that inquiry needs to begin as soon as possible, and they are now demanding that it's a statutory public inquiry, so it would have the power to compel witnesses to give evidence, because they believe that's the only way they're going to really get to the truth and get accountability for what happened.